Welcome everyone. I'm excited to kick off today's presentation with episode 20. This is our first slide, so I want to warmly welcome you all and thank you for being here. We'll be exploring some interesting topics today, so stay tuned. The main focus will be on the key points related to this episode, and I'll give you a brief overview of what to expect. We'll cover the highlights and important insights, all in a concise and engaging way. So let's get started and dive into episode 20. So, Nurse Lily has been assigned to care for a client with Raynaud's disease. Now, it's important to understand that the exact cause or etiology of this condition is actually unknown. Despite that, we do know it has some characteristic features. Essentially, it involves episodes where the blood vessels spasm excessively. These spasms lead to reduced blood flow, which causes the typical color changes and discomfort. When considering the options, it's most accurate to say that Raynaud's is characterized by an episodic vasospastic disorder of the small arteries. It's not about the larger vessels like the aorta or the veins, but specifically the small arteries that are involved. Recognizing this helps us understand the underlying mechanism and how it affects blood circulation in the extremities. This point ties into the overall theme of vascular disorders and their impact on tissue health. Let's take a closer look at D, which refers to episodic vasospastic disorder of the small arteries. This condition is characterized by sudden, temporary constrictions of the small arteries, leading to reduced blood flow. It's important to understand that these episodes are episodic, meaning they come and go rather than being a constant issue. This disorder can cause symptoms like color changes in the skin, pain, or numbness, especially in the fingers and toes. Recognizing this as a vasospastic disorder helps differentiate it from other vascular conditions. Overall, understanding this disorder is crucial because it highlights how small vessel constrictions can significantly impact blood circulation and patient symptoms. Raynaud's disease is characterized by episodic vasospasm of the small arteries and arterioles, typically in the fingers and toes. These spasms are often triggered by cold exposure or emotional stress, which can cause significant changes in skin color. You might notice the affected areas turning white first, then blue, and finally red during the recovery phase. This sequence reflects the restricted blood flow and subsequent reperfusion. Along with these color changes, patients often experience numbness and pain, which can be quite distressing. Understanding these key features helps us recognize Raynaud's disease and differentiate it from other vascular conditions. It's important to see how these vasospasms fit into the broader picture of vascular health and disease management. All right, let's wrap this up by clarifying what Raynaud's actually is. It's an episodic vasospastic disorder that primarily affects the small arteries and arterioles, especially in the fingers and toes. These small vessels are the main sites where the spasms occur, which leads to the characteristic color changes and discomfort. Now, it's important to note that capillaries are too small for significant spasms to happen there, and Raynaud's doesn't mainly affect veins, so small veins aren't involved in the vasospasm. Also, the aorta, which is a large artery, isn't impacted because Raynaud's involves the peripheral small vessels, not the large central arteries. So the key takeaway here is that Raynaud's is best described as an episodic vasospastic disorder of the small arteries. This helps differentiate it from other vascular conditions that might involve larger vessels or veins.